All right, so focused shockwave therapy. So this is one of our fairly newer therapies that we offer. I just want to say that this thing has been a game changer for us. The reason why I brought this therapy in was for my patients that were dealing with chronic long-term pain syndromes. And so that can be, chronic back pain, that can be chronic knee pain, that can be shoulder issues, for example, frozen shoulder, or not having the ability to move in all directions. If you have previous surgeries, if you have degeneration or arthritis, right? So that can lead to more longer term pain syndromes, things that last greater than 3 months. And so what this therapy has been doing has been giving people a solution to the pain. One of our main focus here is to avoid Band-Aid care, is what I like to call that, where you feel good for a couple of days. But this is going in and actually physically changing the structure, physically changing the tissue, the areas that you are experiencing pain by using acoustic sound wave that puts enough pressure to help clear out the tendons and the tissues of any calcium deposits that can start to develop, especially when you've been dealing with it for so long. Crystallization that can also happen in the tissue that becomes an irritant and becomes basically a source of re-irritation. And so if we are able to clear that tissue, then it's also going to trigger your body's immune response to also introduce more blood flow into that structure and also bring more collagen production. We've heard of stem cell therapy. This is another form of stem cell therapy, just using your body's own immune system to kind of re-trigger that healing process and going back into conditions that were previously healed. Generally, we see results after the very first session. I'm talking about tremendous reductions in pain. And once we start to see results with the shockwave therapy, that tends to stay with us, and that kind of changes it permanently. All right, so when we see changes and we see results with the shockwave therapy, then that again leads to more long-term conditions. And so this is my alternative for surgery. This is my alternatives for injections, which are common routes that a lot of patients go down. And that comes with a lot of risk, and it comes with, a big bill. Surgery and injections, that's something that is not that inexpensive to undergo. A lot of times with surgery, there's a lot of recovery, there's a lot of physical therapy, there's a lot of medication even afterwards. There's risk of having to go back in a few years later. And so for my patients that want to avoid those issues, we have shockwave therapy. For those injections, for that chronic long-term medication that comes with the risk of side effects, we are depending on medication in order to function on a daily basis. It's going to lead and transition into more need for more medications, breaking people out of the dependency of, surgery. And it requires way less as far as expense is concerned. The reward tremendously outweighs the risk. Generally, people want to know, well, what's the worst that can happen? The worst thing that can happen from the use of shockwave therapy is nothing changes at all. All right, and so that's another protection layer there. We don't have the risk of it making any conditions worse. We are seeing numbers like 80%, 90% improvement in knees. We're seeing 80% improvement in when we're working on shoulders. There's certain body parts where we see more tremendous or higher probability of seeing the results that we are looking for.